Okay, welcome to today's webinar on pandemic planning, tips for businesses during the 2009 seasonal flu and H1N1 flu season. And today's presentation will be run by Dr. Lawrence Earle of the Immediate Medical Care Center. Dr. Earle is the Executive Director of IMCC, and he's a 1982 graduate of the Medical College of Wisconsin. He also has over 25 years experience in general and occupational medicine. Now, at IMCC, corporate health programs include care for workers' compensation patients, DOT and respirator physicals, as well as hazmat and executive physicals, and drug screens that are run at our urgent care facilities, as well as wellness services, health fairs, disease screenings, executive travel consultations, and many other services provided at your company locations. This year, IMCC provided thousands of flu shots in our corporate on-site flu clinic programs, and we're actively providing consultations to businesses on pandemic flu strategies, which there's an increasing interest in also among our antiviral medication programs. And you'll learn more about all these things today. Think of IMCC as your source for all your workplace health-related matters. And if you have any questions about our services, there'll be time at the end for you to ask those. I also want to let you know that we will be recording today's webinar, so if you want to come back and listen, we'll be sending you a link to the recording in the follow-up email that you'll be getting within a day. And with that, I'm going to turn the stage over to Dr. Earle for today's presentation.
Thank you, Ira. Hi, this is Dr. Larry Earle. Welcome to today's presentation on pandemic planning tips for your business during this flu season. First, I'd like to just give a little overview of some of the topics that we'll be covering today, and you can see those listed here. We're going to be talking why it's important for businesses to be thinking about pandemic planning. We'll talk about the different types of flu that are out there this season. You've heard about a couple of these ad nauseum probably in the news over these last several weeks. We'll talk about some of the differences between the different flus that are out there. We'll talk about what are appropriate response strategies for businesses, what is the right response for different levels of flu activity in your community, and then we'll talk about how to develop a pandemic influenza plan in your business with some very specific guides for you to take back to your company and start doing them. We'll talk about how IMCC or other medical providers can help you, and we'll leave time at the end for questions and answers. So let's get started. First of all, why is it important for businesses to have a pandemic plan in place? Well, there's certainly been plenty of hoopla in the media, and in some cases even panic. This is just a little shot of our Veep Biden here, and his response to something like this would be run for your lives, but we want to take the more appropriate White House spokesman view and think about calming down, and what he really means is jogging is good for you. Well, what we really mean is we want to develop some strategies that make sense and not be in panic mode. So basically, why it's important is we want to avoid this sign on your door. We want to preserve your business functions. And why might they be disrupted? Well, there's a very real possibility of widespread H1N1 or seasonal flu this year. They'll be coming one right on top of another. And there are some estimates that this could affect up to 40% of the workforce in this country. As they said, we'll have both flus at the same time, and disruption in the workforce is not just related to the employees themselves being sick, but people could also be home because family members are sick, or there could be school closures, or even interruption in transportation and other issues that people won't be able to come to work. Your business might also be disrupted because of changes in the patterns of commerce, whether you will see increased or decreased business kind of depends on what business you're in. If you're in something like infection control products, I imagine you're very busy right now. Pharmaceutical pharmaceutical industry, very busy right now. If you're in a type of business that relies on many people coming together, later in the flu season when people might be trying to reduce their contact with other people, that might affect your business adversely. There may be different shopping patterns with people, again, not wanting to be in crowded areas as they were when there was not a lot of flu and infectious disease around. And you could have interrupted supplies or raw materials for your business because of other factors outside your control with other businesses. So we'll talk about some of the strategies to deal with these things. Well, it's also important to plan for pandemic flu to help protect employee health and safety. We would like to ensure a safe and productive work environment so we can keep this nice lady at her desk and working for you. We want to have strategies to reduce the amount of infectious organisms in the workplace. And we'd like to reduce absenteeism. We don't want too many of these seats in your facility, but other factors that might lead to absenteeism. So some of the reasons why this is important. Now, I'd like to just talk a little bit about the different kinds of flus. There are sometimes some misconceptions about what's this flu versus that flu, and how are they different, how are they the same. Well, of course, every year we have the seasonal flu, and this is the real flu that we're talking about, as distinguished from a cold, in that when we're talking about flu, we're talking about the influenza virus, which although both colds and flus can give you some of these symptoms, flu is the kind of thing that gives you very high fevers. It has a very sudden onset with severe headaches, aches and pains. Basically, you feel like you got hit by a Mack truck when you have the flu. You're extremely exhausted versus the milder symptoms with a typical cold. Flu is something that can kill up to 36,000 people annually in this country, and it usually affects the pregnant population. Now, seasonal flu, most people have some immunity. This is usually the same virus or set of viruses. It's usually 2 or 3 viruses that make up our annual vaccinations that are the same each year or that undergo very minor mutations each year. So most people have some immunity to the flu. And of course, we have a vaccine that we expect is going to be available in advance every year. So that's seasonal flu. Now, the big one I guess we're all talking about is the H1N1 flu. Well, let's talk a little bit about where this thing came from. These guys. Well, this is what's known as the swine flu, but now we're calling it the H1N1 flu because we don't want to be too scared of these cute little fellows over here. And this is the flu that surfaced in Mexico and in the United States in March and April of this year. So this is called the 2009 H1N1 flu. And as early as June 11th, the World Health Organization declared that this was a pandemic level 6. This is just a shot of the 1918 pandemic. We don't want your high school gymnasiums to look like this, so hopefully some of these strategies that we'll talk about today will avoid these kinds of scenes. It was declared a pandemic because it was very contagious, not very severe, fortunately, at first. There was continued spread throughout the world, and there is now. And some of the things that make it a pandemic, what pandemic means is that this is a new, basically a mutated flu strain that has not been in circulation before. So it's an unusual type of virus that our bodies don't really have any natural immunity to. And generally these pandemic flus make people quite sick. This one has not had the same type of illness, severity of illness as some of the previous flus, but it has been very easily spread. And the other hallmark is that we have not had a vaccine readily available. It's taking some time, as you probably have heard, to come up with all the vaccine that we would like to have. Now, how long does a pandemic last?